Well, good evening, everyone, to the TLC Health Freedom Tribe. A special hello to you and any new guests and family members and friends. This is Tustin Longevity Center. I'm Dr. Ella Thorpe, and this is Talk to the Doctor. We have a educational open discourse where you can type into the chat on the right if you're signed into YouTube and type in your question, and I will do my best to answer any of your healthcare questions. We are a practice currently of 6 healthcare providers here in Tustin, California, Southern California. We are doing the functional, integrative, alternative, complementary medicine, where we try and look at the natural things to do in addition to any standard medical care. We're focused on prevention, and I myself, Dr. Ella Thorpe, and then Dr. Mitchell is our board certified gynecologist, and Dr. Habermill, our new doctor who is returning with us, board certified gynecologist and addiction specialist. Then we have Dr. Merrick, a gynecologist. She also does our thermography for us here. And then Dr. Kaur, our naturopathic physician, and then P.A. Patel is our physician assistant, and hopefully we'll have Dr. Johnson soon, who is a male doctor, naturopathic physician, and he loves to do research and support educational material, does functional medicine, and will be a nice blessing to all our male patients for their urogenital exams and preventative health. And then we are looking at another physician that would bring us up to eight healthcare providers here, trying to make this a venue in addition to your own personal commitment to your health. So as you look at the questions, and hopefully I can answer them. If I can't, I will tell you that. But I have about 41 years of practicing medicine, and that in the functional healthcare preventative. I've always been that way long before most of the books and stuff on this are coming out, and I'm very pleased to see doctors opening up and including the low carb ketogenic diet preventative in so many areas. Anyway, so it's a joy to be here, and that gives people enough time to hopefully start turning in. And we'll start with our first question, which is from Deanne. And she says, "Hi, Dr. Rita, is it best to take iodoral on an empty stomach in the morning with my Armour thyroid and Vitalzyme, or when?" Iodoral is iodine, potassium iodine, and it is a supplemental iodine. Each tablet is 12.5 milligrams, which is a very standard dose. And what the Japanese have always eaten when you do food analysis of people and their cultures, the Japanese have a very low breast cancer and prostate cancer prevalence compared to the United States, and their daily diet and their foods typically are anywhere from 12 to 50 milligrams of iodine in their diet, where our recommended daily allowance is a piddlance of maybe 150 to 400 micrograms. So yes, I would take it in the morning with your Armour and with your Vitalzyme. That's very good way to do it, Deanne, and that's how I take mine. Deanne also asks, is there any ideal time to take DHEA? Dihydroepiandrosterone is a precursor to your cortisol adrenal, and it is a precursor for your testosterone, for your muscle mass. And it would really not matter what time of day, but if you put me, between a rock and a hard spot, and I had to answer the best time, probably at night, so that when you wake up in the morning, you have your best cortisol response for starting your day. But it really doesn't matter, Deanne. I often take mine in the morning, or it'll be in my evening packet. So I don't have my evening packet. Where is it? Here's my evening packet, and yeah, there's my DHEA right there to take. So I'll be taking it this evening. Let's see, what's the next question? Cindy Love asks, what can one take to get rid of intestinal parasites? Well, if you think you have intestinal parasites, if you're seeing pinworms or other things, you should have your stool tested and see your doctor. Most often, we do not have this as Americans because of our great sanitation, which has improved our health. You can make the argument that carpenters, pipe workers, plumbers, your cement construction, your sanitation men picking up the garbage, and the sanitation department, those have done more for preventive health than anything in the United States. So it's very unlikely that you do, but if you think you do, go to your doctor and get a stool test. Now, there are herbs, there are natural things that we can take. One of them is grapeseed extract, uva ursi, Argentine silver, if you can get it. Only doctors have Argentine silver, even though it's not a prescription. It is a nanoparticulate silver that kills off parasites. Grapeseed extract, what else? These various natural herbs, and there are others, there are several, are associated with die-off of many and various types of parasites that we know about. So there are products. We have one called Candicid Forte, and the other is called Intestinal. These are various concoctions that we have used when we do our stool studies. We try not to use antibiotics if a patient known by their doctor personally is in a good state of health and there's no rush to go to any antibiotics or anything more aggressive. We use these herbs in diet. We ask them to be on a low-carb diet because very often a high-carb diet will promote bad bacteria and promote candida, yeast, and parasites. So that's what I would say for that one, Cindy. Jenna asks, hi from North Carolina. Hi, Jenna. Your metabolic formula and fasting have helped me lower my hemoglobin A1C. Wonderful. Praise the Lord for that. What do you recommend to lower my triglycerides? Well, it's the same thing, Jenna, in the sense that as you stay low carb and are on a keto-like, ketogenic type diet, your triglycerides should continue to descend over time. There are prescription medicines with side effects that I would rather you try the diet aggressively, but see what your doctor in North Carolina says. Exercise and a low-carb diet would be the best thing. Stay on your TLC metabolic formula. When your triglycerides are getting into the 50s, 60s range, when your triglycerides are about the same level as your HDL, the good cholesterol, when these two numbers are equal, it is a sign of great health and prevention for heart disease. So stay with your low-carb diet, ketogenic diet that will lower your triglycerides. Because if you take in bread, pasta, sugar, fruit, bread, beans, rice, bagels, cereal, candy, juices, juicing, you get too many carbs, and it's more than we can metabolize. And so your body will convert those sugar molecules that are kind of like sew them into little chains and make triglycerides floating in your body. And then they'll stuff them in your fat cells to make you gain weight to store up that energy for later use if you ever get to them. So most of us are eating too many carbs. We're getting overweight. We have a obesity epidemic, and the children especially, and that's from all these junk food, prolonged shelf life, processed foods. So that's what you want to stay away from. Dion asks, should an 83-year-old who has had a hysterectomy be taking progesterone? If so, how much, how often, and what kind? Thank you. Well, Deanne, if you're on estradiol, you should be on progesterone because it's the natural use physiology of estradiol and progesterone is only taught very sparsely in medical school physiology. And they think that if your uterus is taken out through a hysterectomy, then you no longer have need for progesterone. But there are progesterone receptors in your bones for building bones. There's progesterone receptors in your brain for helping you sleep and have a good, deep, restorative, refreshing sleep. There's progesterone receptors in your thymus and your sinus area, lung area. So there are so many areas in your body in addition. But the other thing is, if you're taking the estradiol is designed to have a physiological job that is balanced by progesterone. So even though you don't have a hysterectomy, even though you don't have a uterus because you had a hysterectomy, you're on estradiol, you need to balance that with progesterone. Now, most people just take progesterone as either a cream and they rub it on to their body. In fact, I forgot my progesterone cream this morning, so I make this here myself, and here's one scoop, here's another scoop, another click. And so I'm just going to rub this on to where my blood vessels are so I get my balance of my progesterone. And I use that because I'm on estradiol to stay mentally healthy, bone-wise healthy, immune healthy, mood healthy, cardiovascular healthy, bone healthy. And so I hope that answers your question. We have the capsule form of natural progesterone, and that's usually a 100 or a 200 milligram. I take my progesterone cream as a first through the 15th of the month, and then I don't take it the 16th through the 30th or 31st. And when I stop the progesterone, because I'm on estradiol all the days of the year, you can have, if you have a uterus, a light menstrual showing. And that's just, maybe I'm cheap and I would like to just save money, but whether you take the capsule, which is oral, or you take the cream, it depends on getting your lab level so the doctor can see how well your skin absorbs. And what else could I tell you about that? I think that answers your question then. You could use the progesterone every night or evening, or you could use it half the month. It really doesn't matter. Somewhere in the realm of 100 milligrams to 200 milligrams. All right. Damien says, greetings and blessings, Dr. E. Same to you, Damien, and all the Health Freedom tribe here. Can a lipoma about the size of a marble be removed without surgery? These are fat cells that have abnormally been packed and stacked with too many triglycerides from carbs. And they can pop up, and they're usually seen in the skin as a soft, non-tender lump. And they can be bigger, they can be smaller, and they're randomly scattered around. And I have to just say, people who go on a low-carb diet have the greatest potential for them to be reabsorbed. And I would probably take that with systemic enzymes as well. But I have to just say, very often they never go away. So often people have multiple lipomas, And because they're unsightly, they do have them surgically removed more for cosmetic reasons than for any disease process concern. So if it's in a place that isn't bothering you, like at your belt line or your bra line, very often you can just let it be. Have your doctor see it and look at it to feel confident that it is just a lipoma. And but a low carb diet would be the direction, but you would have to be very low carb, and you would have to be consistent with that to see any hopeful changes. But in general, I usually see the lipomas never change. Viswataja. I hope I'm saying your name right. Good morning or good evening, because it's 6 o'clock. I was a smoker and now use nicotine gums. Are they safe to use? I always thought nicotine and caffeine are similar stimulants. There's a lot to be said about the term nicotine. We have nicotinic receptors in us, and so there is a role for nicotine in human physiology. Cigarettes, the burning of tobacco and then inhaling it, does deliver nicotine through the tobacco plant as it's burnt and aerosolized, and you bring it in. But the unfortunate thing is, when you smoke cigarettes, you get in the other many tars and noxious products from the burn. So I'm so proud of you for not smoking cigarettes anymore. Therefore, now the concern is in vaping, there's nicotine and descending amounts of concentrate in nicotine vapes, and they can jazz them up with all kinds of flavors and colorings. Many people have gone from cigarettes to vaping, and if they do that, I encourage them from getting off of the cigarettes, because it's far safer to vape. But I would tell them not to put in the flavors or colorings or any of that, to just use it as a medical assistance in them getting off of that habitual use of cigarettes with all the tars. So nicotine gum is probably safe if that's all that's in it. So to find out if this is a medically prescribed gum, if it's over the counter, I get more concerned due to production of what's in it. And then, of course, if you vape, then you have to be concerned about the producer of who's ever claiming that you're getting the most benign form of the vape with just a diminishing nicotine. So it's a challenge, but I would say that you're doing well and you're doing the right thing. And nicotine, in and of itself, in a tapering fashion, is a safe thing to do. Same thing with caffeine. Caffeine, we do have receptors for the metabolism of caffeine, and it is a stimulant. There are some people who are hypersensitive to it and cannot have it. My husband can't tolerate it really at all past 1 cup in the morning. But I can drink a big mug of it like this right before I go to bed, and I sleep like a baby. So it's just amazing, the creation of the human being, and how marvelous and wonderfully and fearfully wonderfully we're made, and different at the same time. So caffeine, you can overdose with that if you're taking it as a separate stimulant. So again, be cautious about the amount. Talk with your doctor about that, and try and use the least amount that you can. Would be the only thing. But I compliment you for getting off those cigarettes. Good girl. Or I believe that's a feminine name. Okay. Deanne had another question. Let's see, where is that? Yes, here it is. Taking the time to answer all our questions on a Monday night. We appreciate you. Oh, bless your heart. Well, you are special, and it's, I'm giving you, the best that I can answer. Hopefully it's the right answer always. Thank you again, Deanne. Karen, hi, Dr. Rita. When is the best time to take Orthospore IG? I'm going to say it doesn't matter. I take mine on an empty stomach in the morning and the evening. So in my little packet tonight that I'll be taking, I have my Orthospore also. And I only eat once a day. So I ate around, I think it was 11 o'clock today that I ate my hamburger and my walnuts. And so I'm going to take my whole packet. That'll be my dinner, folks. Here's my dinner. Anyway, it is probably either or. It doesn't matter. It is going to be dispersed, and then hopefully it'll have its largest absorption and predominance in the colon part of you. It really isn't something that we want in the small intestine so much. It's in the colon. So anytime is fine, Karen. We have another question from Viswataja. Okay, best cooking oil among these for daily cooking: peanut, sesame, mustard, coconut, canola, rice bran. The only one there is coconut. I don't use any liquids, oils for cooking because for an oil to be liquid at room temperature, it means it has unsaturated bonds in it, which when it hits the heat of the pan or in cooking, it'll be fractured or hydrogenated, burnt, oxidized, and then you'll be getting trans fatty acids. So there are no oils that I would cook with, none, zero, none of them, just the coconut because it's solid at room temperature. I would use lard, I would use butter, coconut, those are what I use. Jenna says, what are your thoughts on Prevagen for brain health? Or what would you recommend for help with focus and memory later on as I age in a high-stress job? I'm not sure what Prevagen is. Let me look that up. Prevagen. And yes, it's fun to do this because Prevagen. Oh, it's a brain supplement, and what's in it? Prevagen ingredients. They don't make it easy, do they? I guess you have to click on one of these and see what's in it to see what's in it. Let's see if I can click on one of these and see what's in it. There it is. Vitamin D. It has apoequarin. All right, other ingredients: sorbitol, mannitol, beet juice, casein, peptones, citric acid, lactose, magnesium stearate, maltodextrin, cornstarch, agave fruit, inulin. I don't like it. Sorry. Whatever Prevagen is, I don't like it. It's got some mixed berry chewables with vitamin D, apparently. So I just listened to Dr. Brevedine. He is the doctor who is notable as a neurologist for writing the book Reversing Dementia. And fortunately, the lecture I listened to of his yesterday, I've been doing for years and years, long before he wrote his book. So the brain needs circulation, and the circulation is tiny, tiny little hair-like, angel hair-like capillaries. So EDTA chelation therapy, of course, it's an FDA approved, but no longer patented drug. So the use of FDA-approved medications that are out of patent are not promoted in therapy, but it's fabulous, just like ivermectin and hydroxychloroquine are fabulous, but they've lost their patents, so they don't make money for anybody. So improving your microcirculation is best with chelation therapy, removing heavy metal toxins, oxidizing, damaging to the heavy content of fat in the membranes of the brain. Another thing is a low carb diet. Fasting is very stimulating to the brain. It stimulates brain-derived natriuretic factor, which stimulates neurons to grow and to maintain the bulk, the size, because with age, all of our brains shrink a little bit. The other thing would be to eat healthy fats, eat your egg yolks, eat your grass-fed, grass-finished beef and your eggs and your grass-fed pork and prairie-raised chicken with a skin in it, because we need that to make the membranes on our brain cells. Get wild-caught fish. Use the oils. I want the alpha lipoic acid. No, not alpha lipoic. Alpha linoleic acid and linolenic acid. These are the essential fatty acids of the human body and the cell membrane, not fish oils. And so using parent essential oil or clinician's preference, flaxseed oil and butter, lard is good for the brain. What else? Because it keeps your blood sugars low. Exercise is good for the brain. Stress management is good for the brain. Hormones are good for the brain. Testosterone for men, estradiol for women, and progesterone. Dihydroepiandrosterone for adrenal stress management, a good sleep with exercise. So all these things help your brain. Vitamin D, D3 is helpful. So this is what we do already, and so fortunately, Dr. Brevedin, in the lecture just a few weeks ago, reinforced everything I've been doing for decades. So we thank the Lord that we're still on track here and doing it right. Let's see. So hopefully, Jenna, that is the direction I would go, not Prevagen. Sarah Mejia. Hi, Sarah. Hello. Theoretically, there is a certain amount of protein someone should have in accordance with their weight, especially in the world of powerlifting, weightlifting, and is strictly followed. Well, yeah, people usually take 1 gram per kilogram for powerlifting. Some take 1.5 to 2 grams, so they push that, but they got to drink plenty of water. So a man, they go by kilogram. So let's say a man's 200 pounds. That's roughly 85 to 90 kilograms. So at 90 kilograms, he would need 90 grams of protein a day. And let's see, if we did a standard piece of how many grams of protein in a steak. So if you look at it, let's see, it'll say roughly a steak has, in an 8-ounce steak, that'd be a smaller steak, has about 58 grams of protein, roughly 60 grams in a standard steak, 60. So if a man was eating 2 steaks a day, maybe 3 or 4 hamburger patties a day, I think, how much does an egg have? Let's look up in a egg. An egg has 6 grams of protein, so you would have to have 10 would be 60. You would probably have to have 20 eggs. So protein is a good source in eggs. It's a complete food. But hopefully, Sarah, that helps you out. 1 to 2 grams per kilogram of a man's weight, and a man who is 200 pounds roughly is 90 kilograms. So he would need 90 grams. There's 60 in a steak. So if he had 2 steaks a day, that would really help him with powerlifting and muscle building. And let's see, what else? My question is, if someone is trying to cut weight because they are not on an ideal weight, can they cut protein and still be okay lifting heavy? May they see a decrease in their gains? Yeah. Well, this is like a black box. There's so many things that go into it: blood type, the ability to digest the protein, the age of the person, their health condition. But if you're doing, reps of resistance training, and you're doing your upper body muscles and you're doing your lower body muscles, and you're doing that about 4 times a week, and you're a healthy man, let's say an average man in your 30s, I would think that you should be able to build muscle mass and maintain a healthy weight, and the fat will be diminished because you'll be so satiated if you had 2 steaks a day. All right. So no, I don't think they'll see any loss in their muscle mass gain. Maxine says, "Hi, Dr. Rita. God bless. Thank you, Maxine. Do you recommend taking MCT oil?" Yeah, it's fine. MCT oil helps your body to produce ketones, especially ketones help diminish your appetite. So if you want to lose weight and you're having cravings, taking a tablespoon of extra virgin quality virgin oil, olive oil, taking a tablespoon of MCT, medium chain triglycerides, putting that in your coffee, the medium chain triglycerides, not the olive oil. That will help your body to make ketones, and ketones are the byproduct of fat metabolism, and that is a signal feedback that you've eaten and that you are satiated. And so, yeah, I'm in favor of MCT oil. I don't particularly use it. I have used it in the past, but I'm not against it. Christopher says, "Hello, Dr. Rita. Any books you recommend that's against the vegan diets?" There is a wonderful book out there called The Carnivore Cure, or maybe the word "the" isn't with it. It's called Carnivore Cure. And with that, it is written by Judy Cho, Chho. And it's an excellent review of the whole area. One of the foundational books is called The Big Fat Lie by Nina Teklotz. Nina Teklotz is not a scientist. She's a science writer. But she did an excellent job in review on all the books up until about 2016. There's another book by the name of Good Carbs, Bad Carbs by Gary Taube, Taube. And that's the classic book that came out around 2000 and probably propelled Dr. Lustig and so many other doctors into the low carb diet. I was pleased when he wrote his book in 2000 because we were already low carb. So hopefully those are some good ones for you. And they do take on the question of, the vitamin deficiencies in a plant-based diet, the lack of fat that were critical to health that are essential to life. So we only have essential fats and essential proteins. There are no essential carbohydrates. These reviews also clarify the bias of the books like the China study that conveniently leaves out discussion of the type of beef they criticize. If you go to industrialized farming where they have the cows all locked up on feeders and drugs and antibiotics, they fatten them up with all the starchy, carbohydrate-rich grains, which a cow would never eat normally. And then their beef becomes inflamed, and their biopsies of the meat of these industrial farming cows are just damaging and no good, and their grains will actually create allergies in the people. Grass-fed cows, if you biopsy them, their essential fatty omega-3, omega-6 ratios are very favorable, almost a 1-to-1 ratio. So hopefully that helps you, Christopher. Nora says, hello, Dr. Rita, I have a fatty liver. It is impossible to see the specialist. I am ready to pay for my visits to your office. Would you please help me? I'm really asking you. Well, praise the Lord. We'll be happy to see you, Nora. The doctors today are increasingly realizing that fatty liver disease is and must be addressed, and your doctor should be competent to understand that the keto-like diet, the low-carb, carbohydrate diet is the direction to go. Of course, alcohol would be another thing to avoid, as well as a high fructose would be horrible. So avoiding fruit, juices, starchy, standard of American SAD diet, and eating a more paleo-like low-carb diet will be the direction to go. I would do some resistance training exercise that will build up your muscle mass, which will increase your resting metabolism, which will burn more of your sugars down. We can give you natural things that will help assist your insulin resistance that is likely associated with a fatty liver. But if you, Nora, would call the office 714-544-1521 and ask for my nurse, Terry, and tell her that you were on the Ask the Doctor last night on June 13th. She'll be here in the morning. And that you need to be seen, and I will oversee and make sure, if not me, one of the doctors here is very capable in managing you and to get that fatty liver reduced. And we would be blessed and honored and privileged to be the ones that help you do it. And we'll monitor you and watch your progress and check for other things. So God bless you, Nora. Phyllis says, any natural recommendations for treating Sibo, small intestine bacterial overgrowth? Have heard that probiotics can make it worse. Well, Sibo very often is based on a history of a higher carb diet in the past. And then you get set up a flora, a predominant microbiotica in your microbiome in your gut of the bacteria that are more fermenting and gas producing. And so with a low carb diet, with a complete digestive stool analysis, we can actually get a feel for the type of flora that you're producing, and we can use herbs and other things like one of the other earlier questions today, and give you maybe grapeseed extract or colloidal silver, or what we use here is Argentine nano silver, and give you a probiotic that is designed for gas, and that's one of the Orthospore IGs. And so, Phyllis, yes, there are things that we can do: a complete digestive stool analysis, look at your insulin resistance, look at your hemoglobin A1C, your insulin level, your high fructose corn syrup or fructosamine level. Get your stool flora, look at sensitivities on it, maybe your sensitivities to food. Lots of things we can do here for that, Nora, for you. Oh, Phyllis, yeah, it was your question. There you go. Nora had another question. I am a dedicated educator who devoted extra hours to my students, okay? And your dedication to your parents reminds me of yourself. Well, God bless. Yes, we are dealing with a healthcare system that has kind of commercialized medicine and isolated the training of physicians by a biased system of a pharmaceutical sponsored healthcare system. And we no longer have doctors that, want to understand the whole body, to be able to handle questions of anything like this, all parts of the body. They want to just have a narrow area. And really the best fun in medicine, I think personally, is to know the whole family and to know the whole body and to live and watch their children get born and grow up and then them have children and the grandchildren come and just settle yourself in one place for decade after decade after decade after decade and be that people's doctor. And we don't encourage that anymore. We always promote money, position, professional grooming, you might say, instead of service and the privilege of being a doctor. So it is a great privilege. And really being a general practice family doctor, pediatrician, these are the lowest paid jobs and in medicine as a doctor. And yet, if you love your people and what you're doing and you really keep up with your studies, it's the most rewarding. So I would imagine being a teacher. My oldest sister was a teacher and she stayed put and worked in the same school decade after decade. And she had so many loving students that would come in and stop in. What a joy it was for her to see them show their maturing, their children they had, pictures. It's just a gift. People are, my God thought that everyone was so valuable that he died to pay for all our sins. So I have to look at every soul that comes to me as someone that God so loved that he gave his only begotten son for. So there you have it. All righty, let's see. Robert, hi Robert. You're the man who sends me all my jokes. Is this a joke or a question? I came in to get chelation and I asked the nurse if she graduated from Harvard or Princeton. She said no, but why do you ask? I said, I assume you went to an Ivy League school. Yes. Robert, we love jokes that are so clean and beautiful and mentally challenging. Thank you for the gift of the humor you bring to our TLC Health Freedom Tribe. Thank you, Robert. God bless you. Lisa, hi, Lisa. 28-year-old son has a cyst in the left breast and swollen lymph gland on the left neck. Docs treated him with antibiotics. Could this be from 2 COVID jabs booster, having COVID 3 times in the last 6 months and or high stress at job? Answer is yes and yes. So I would go low carb to starve the stimulation that makes anabolism is to grow things. You want to catabolize and chew this up. And the lymph nodes probably have been a site where a accumulation of monocytes that have some of the messenger RNA gene, messaging there. And there could be spurts of this spike protein being coded for and made, and so he'll have inflamed lymph nodes. The sugar, starch in a diet, along with cortisol stress, is very sugar promoting and fat metabolizing, and it will promote with stress the higher amounts of estrogen in a young man. And that can also make more of this gynecomastia, glandular material under the nipple of a man, and some glandular material. So he could use progesterone cream. He could use the over-the-counter Kokoro. He could use Vitalzyme, 5 twice a day. He could use, to block the spike protein production. Quercetin, I could, if he were a patient of mine, I could give ivermectin to help bind this. EDTA chelation will help bind this. The enzymes, systemic enzymes, will help chew up debris, and a low-carb diet. All these things will help. Christine, hi, doctor. My 4-year-old developed a dermatitis on the bottom of his big toes a year ago. He was sick at the time, and I gave him 2 showers a day. Any ideas on what I could try to do to get rid of it? I would encourage you to make sure there's healthy fats in his diet. Often dermatitis is associated with essential fatty acids, and the American diet is so processed, and hydrogenated omega-6s are so prevalent. The skin integrity and food allergies becomes an issue. So if he ate real food only, nothing that opens up from a bag or a package, so you can have cooked vegetables, his chicken, his fish, his beef, his pork chops, and so forth. I don't think I would give him any dairy. I would avoid the grains, and I would stick with things like squash or yam, or maybe some rice, but keep the carbs low. And then we have the liquid form of the clinician's preference oil. This is the oil that I use. My dad was in food research. This is the 2 human essential oils. This is the same thing as this. It's just liquid, so you can take it that way. And I would give him, a teaspoon a day. And I would actually take a drip of it, and I would rub it on the site of any eczema or dermatitis, because that is what the skin is made of. If you look at the charts here that show the cell membrane is a double layer of phospholipids like this, and in this area here on the cell membrane where the protein receptors are, there are these fats that hold the receptors into the membrane, and those are the linoleic, alpha-linoleic acid. And I've showed it in the past here with my stick diagram, but that's what this is, and this has healed and helped so many, many people. That's what I would encourage to do. See your pediatrician, or have the child come here and be seen if you're in our area, Christine, because this is usually a fatty acid deficiency. Maybe the child is not getting enough vitamin A. I would certainly encourage eating the yam or the squash, or get them on Juice Plus. That would be excellent with the extra vitamin D drops, and have a doctor look him over and work on that. Garden Fairy says, let's see, where are we at? I missed something. There we go. Well, we got a lot of questions. I better try and do as many as I can. Do you think pharma has something to do with the disinformation regarding safe hormone treatment for women? I shared a lot of info with my friends, so she was ready for the scare tactics today when she asked her doctor. I really think that they're just not educated. They haven't learned enough human physiology. They've become so technical and isolated into specialties. They're really not good for the whole body, and everything is connected. So we have a YouTube video called uh, um, uh, Natural Hormones Asked to Gynecologists. If you go to Intestinal Longevity Center, our video on YouTube, and you scroll back 2 years, you'll see Dr. Merrick and Dr. Mitchell sitting at the desk there, and the title of it is To Gynecologists Natural Hormone Therapy, and they'll review this. A wonderful book on this is called Estrogen Matters. You could get that from Barnes and Noble. Indy says, is there any solution to chronic recurrent UTIs without continuous antibiotics? The antibiotics take such a toll on the body and they're no longer working, really struggling with this. Indy, very often doctors will say, give me a urine sample, and then they'll just hand you a cup and you do the best you can cleaning up, and then you pee and you get a dirty sample. So I wonder how many, in fact, urines are truly infected. I would say 20% of mine are not good, clean catches. And it's hard for a girl to do this because of the lips and the hair and all that. But one of the things is overdiagnosis from poor sampling technique. The other thing is, as we age as women, our lining of the female genitals thins out. And so bacteria and irritants become more irritating, and the actual urethra doesn't have as much structural texture anymore to shut and close. And so you can have some ascending of bacteria, especially if you're sexually active. So you put all those things together with a high carb diet that feeds bacteria, and the loss of the structural integrity with loss of hormones, and so forth, you have these problems. So D-mannose and cranberry extract, if it's a quality, we have two products called cystatin, and the other is called Uratrax. One's the D-mannose, one is the cranberry. They're very good. But you need to work with your doctor, and if you can't give, and some women it's too hard for them to be able to give a clean catch, we can do, or your doctor should be able to do an in and out clean catheterization with a tube and get a perfect sampling and track you so you are not unnecessarily treated. Dorothy asks, how can dementia be reversed when it is too late? Well, if you listen to the first part of the lecture, Dorothy, there's an argument that it's never too late because we have now what is called neuroplasticity. 40 years ago in medical school, when I was in training, they said nerves don't grow again. That's not true anymore. We know they do grow. Exercise helps your brain grow. Listening to classic and having social functions make the brain grow. A low-carb diet, fasting stimulates the brain to grow with brain natriuretic factor. Natural hormone restoration helps the brain grow. So there's many, many things you can do. EDTA chelation helps the circulation. Carol says, please look up Dr. Zach Bush. He's wonderful. You know, I got that, Carol, and I never looked him up from last week. I do believe I have that still listed here. Yes, Dr. Zach Bush. So thank you for reminding me, Carol. I will do that. Dolores says, hi, Dr. Rita. I have osteopenia and have a bone spurs in my feet. I used to check my pH by urine first thing in the morning. What are your thoughts? Well, your urine is a waste material, and it is supposed to be more acidic. It is supposed to be getting rid of your free radical and waste products. So it's not wrong to have a pH of a 5.5, 6.5 in the urine. If you drink enough water, it'll be closer to 6.5, 7. Most of us don't drink enough water. We should be drinking half our weight as ounces in pounds. So if you're 200 pounds, you need 100 ounces of water, roughly 16-ounce bottles of water. And then we are not stretching enough. Stretching helps. We lose our enzymes with age. And so we build up little tiny micro tears and inflammation. And then the body makes these calcifications where the tendon is hanging on the bone. And those little tendons will start growing a protective calcium spur around it because we're not taking enzymes. We're eating an acidic, high carb diet. So there's many things that you can do to help work with that. So hopefully, if you work on your these things or see a doctor who's familiar in this kind of work, Pilates, water, enzymes, natural hormone, low carb diet, and walk you through this and take a good look. Jenna says, thanks for your opinion on Prevagen for lowering the triglycerides besides diet and exercise. Do you recommend any of the supplements from the TLC shop? Well, we have membrin, membrin, and that is a combination orthomolecular of the nutrients known to be very valuable for healthy brain and nerve function. So that would be one. It's called membrin, membrin. Lisa says, I had COVID in mid-May. About 4 days ago, I started menstrual bleeding with more blood than I've had for in a year since these last days. I'm on progesterone days 1 through 15. Could it be related? I think it's more related to the fact that you're on your progesterone and coming to the end. And the natural course of progesterone is to produce a menstrual cycle towards the, once you've been on the progesterone 5-7 days, it's supposed to get you ready to shed that menstrual flow. But if you have any concerns, have yourself seen here by our gynecologist and address this. But that's exactly what is happening with me. I'm on my progesterone day 1 through 15 of every month, and it's about now that I should start seeing a flow. But I have to admit, I have not been, I've been so crazy busy and then wiped out at night. I just fall asleep in my chair, and I haven't used my progesterone as faithfully. That's why I put it on right now. So I think this is probably normal, Lisa, but to address that properly, please see your doctor and have follow-up on that. Cheryl says, what dental materials avoid heavy metals for fillings? These are the porcelain fillings and for the crowns. Which is better, porcelain, yes, or zirconium crowns? I wouldn't say that I'm an expert on it, Cheryl, to know the difference between zirconium. This will be the first time I've heard of zirconium. So I'm going to have to write that as a dental porcelain versus zirconium. Zirconium. So I couldn't tell you. There is a doctor, Laio, L-A-I-O. I went through, what is the name of it? Washington. I did this in Washington, D.C. for 2 years. I got a doctorate in integrative medicine, and he was a dentist, and he went to it from the dental point of view. And so Dr. Laio, L-A-I-O, and he is a biological dentist. Then there's other biological dentists. Dr. Sun is in Orange County, S-O-N. And there's another one around. And they would be better to ask those questions because they are what we call natural dentists. Lisa says, the question asked by Chris reminds me to also tell you our son is a vegan, if that affects your answer. Thanks, Dr. E. Blessed to be live with you for the first time. Well, Lisa, I would say, because he's probably too high of a carb diet, which will promote estrogen production, which will promote gynecomastia of the hormone-sensitive tissues. And men do have very, very slight glandular area in their underneath the nipple area. So yeah, alcohol, beer, all those things will greatly promote it. What do I think about the low FODMAP diet? Yeah, I think that's a good diet as long as you are mindful of the carbs. Indy, for someone with Hashimoto's, do you think a paleo diet is best? Yes. Coupled with reactive hypoglycemia, yeah, but that's from carbohydrate damage. You have to get through that, and you will. You have to stop the insulin sensitivity, because you'll a high carb, you'll shoot out the insulin, it'll crash your blood sugar, and then you'll have that hypoglycemic episode. You have to taper off the carbs to get out of that situation. Dorothy says, is Dr. Johnson coming aboard your clinic, and what is his training? He's a naturopath, and he does a lot of those, joint PRP, ozone injections, things like that. And we're working on it right now. It might be a couple of months before he gets here. Thank you for asking. Christopher asked, thank you for answering my question, Dr. Rita. I'm going to buy those books. God bless you. Thank you very much. Cindy Love, what can someone do if they have yellow liquidy stool and stomach pain after eating that's lasted 7 days? Well, I would see your doctor. It doesn't sound like you're making enough bile. That's what darkens your bowel to be a brownish color. So if it's more of a yellowy, you could have a stone blocking your cystic duct and so forth. So I would see a doctor and address that. The first thing I would do, though, is go on a clear liquid diet. I just wouldn't eat anything. I would be on just chicken broth, beef broth, and I'd mix water with a little ginger ale, and I wouldn't do anything food-wise for 2 days. See your doctor, and of course, if it got worse, you'd have to go to the urgent care ER. But it doesn't sound like you're secreting enough bile. And resting your bowel like that is very healing, but do see a doctor on that, Cindy. Jenna says, speaking of pre and probiotics, I take 2 pills a day made by the company Seed It. Costs $50 a month. I do not have any digestive issues before. Any recommendations on something that will cost less? I don't know the prices of things because I have my supplement here deducted out of my paycheck. So I personally like Ortho Molecular, their research. I've been there. I see their plan. I go intermittently there. As a prior chemist, I was an analytical chemist. I understand their testing and their shipments and quality service. So I really like the broad spectrum coverage of orthobiotics as a 1 capsule per day in an otherwise healthy person. So that's what I would do. But call the Vitamin Shop 714-544-1521. And Orthomolecular has various products. One is called Orthospore IG. That's for people with more of the gassy, irritable bowel. Orthobiotics is for prevention. Probiotic 225 is the powerful powdered form for an acute illness. Cheryl says, so if someone has a lot of gas and bloating, they should take the Orthospore IG. Yeah, that's what I would do. Constance, what is the difference between digestive enzymes and systemic enzymes? The digestion is to help you eat and break up your food into assimilatable fragments appropriately. And you have to make enough enzymes and hydrochloric acid to chop up your proteins and your fats. The amylase is for the carbohydrates. Usually people don't have trouble with carbohydrate because that's so instantaneously, easily digested. So old people like to eat carbs because they don't make the enzymes they did when they were young, and then they lose their muscle mass and they age and die. So we ask people to take a digestive enzyme no matter what your blood type is, by the age of 60 at least with your dinners, to help you get more out of your food. A-type blood people probably need this from their youth on, because A's as a class don't digest as well. Systemic enzymes are made for inflammation, cleaning up debris in your body, pain and inflammation, and these are taken on an empty stomach, and they're encapsulated so that they pass through the gut digestive system and are released in the lower intestine, where it's absorbed into the body for joint pain and sinus congestion, any side of inflammation. So one's for the system on an empty stomach, the other is with food to help you digest it. Damien says, my husband Ben had his blood work done today. His hair is thinning, and he wants to know if the blood report will let you know how to address this hair loss. Well, I'm incapable of looking into his chart right now. If you call in the morning and you ask a note for me to have my nurse check, I'll look and see if his dihydrotestosterone was ordered. Not shaken. Hi, Dr. Rita. My wife is pregnant and has a bad acid reflux and getting no relief. Are there anything she can do or take? Yeah, I would use, find out what her blood type is, her ABO type. Very often with all that pregnancy and the pressure on the stomach, the emptying of the stomach is more limited, and the junction between the stomach and the esophagus is strained, and then you'll get a little burping of that stomach contents reflux, and that'll give you the indigestion and acid taste, funny taste. We use L-glutamine, GlutaShield. We use Glutagenics. It's just a nice protein lining for the enterocytes that line all the gut all the way to the anus. And you can take a big heaping spoon of this in water and just chuck it down, and it should immediately make you feel better. Even a tablespoon of extra virgin olive oil would be helpful. But if she's a blood type A, she might have trouble digesting fats. So find out what her blood type is. So those are beginning things that you can do. So we're after 7. I'm going to end today. If I rushed through to get all the questions this time. So I would just say to everyone, God bless you. And I will be back here next Monday evening at 6 o'clock. One last question came in. How long should I take D-mannose to treat a UTI? But a few days. Well, you need to work with your doctor. If you're not feeling better within a day or two, then you should have that followed up. But to all of you, I say God bless you, and possess your health and help your loved ones, your family, to eat right. Try and set a good example. And may the Lord keep you until next Monday. God bless.